because I have one quick question to ask you. And that question is, do you catastrophize when it comes to your pain? And the reason why I'm asking that is a couple reasons. It's a very common behavior that my clients with pelvic or sexual pain actually struggle with. And also because May is Pelvic Pain Awareness Month. So that means that it's really important for us to understand pain better and hopefully to learn a little bit more about your pain and how to manage that pain. So back to my question, do you catastrophize about your pain? When I speak about catastrophization, what I am referring to is a person's tendency to think the worst about their pain experience. And, I think all of us at some point in our lives have done this. An example would be as if I sprain my ankle and I have a big half marathon to run in a couple days. I might start to catastrophize about the fact that, oh my gosh, this is the worst thing that could possibly happen. Am I even going to be able to run my half marathon? Okay, so that's a pretty typical way that we tend to behave in a catastrophic manner. And when it comes to an acute injury like that, that's actually quite normal. But typically we sort of, have a short moment of catastrophizing and then things just get better over time. Some individuals actually struggle with catastrophizing with regards to the pain for a prolonged period of time, and that actually doesn't help pelvic or sexual pain issues. And when I'm talking about manifesting or staying in this sort of catastrophic type of behavior, there's a few components that you want to think about. So the first would be magnification. So do you tend to magnify your pain? Like I mentioned earlier, like, oh my gosh, this is the worst thing that could possibly happen to me. That's an example of magnification. Another piece of that is hopelessness. Do you feel hopeless about your pain? Another feature of catastrophization. And then the last is rumination. And rumination is, tending to be obsessive and constantly thinking about your pain day in and day out. So if any of this rings true for you, then perhaps you are catastrophizing a little bit. Take a moment to think about that, and if you are, then perhaps see if you can try to think about your pain differently or behave in different ways, because catastrophizing with regards to your pain and in a lot of cases can make your pain experience worse. Okay, so I hope that makes sense to you. If you have any comments or questions, leave them below.